Good afternoon. Welcome to another week of live session with me, 𝐻𝐿𝐻𝐿. Welcome to 𝐻𝐿𝐻 Academy Reading Live. Hope you had a lovely 2 days of soothing time, and not for people. I'm sure that people who went and wrote the exam, they had absolutely lovely time. Yes. So really happy to see you all again right in front of me. What else could you ask for, isn't it? When you were all there making the most out of whatever that you could. For all the students who have taken the exam, they all said they had a lovely time writing the exam. Good enough. Sophia Jiten, good afternoon. Sini Nikle, good afternoon. Very nice, very nice. 𝐿𝐻𝐻 𝐷𝐿𝐻, good afternoon. After some time, all these profound names, but after some time. So nice to see a mix of new, known people. Yes, Christina Bobby, good afternoon. Very nice. So we were all so much eager to come in front of you to see how have you been for the past 2 days. Sri Chitra, good afternoon. So I've seen few names with no icons next to your name. So if you have not yet subscribed to our channel, if you have not yet clicked the like button, if you have not yet clicked the follow up button, please do not hesitate to click all those so that you will never miss all the important insights that 𝐻𝐿𝐻 Academy has for you. Shalini Shumod, good afternoon. So very nice, because all the people whom I have read for you, they have at least one icon next. You can see a heart-shaped number 1 icon, flag. So yes, so that shows how much of a support you're all there giving for all of us. Lydia Paul, good afternoon. Very nice. A lot of known people who have been there. So that's how much of a support you're all there rendering towards 𝐻𝐿𝐻 Academy. Monica Vegas, good afternoon. Kavita Balaji, good afternoon. Lakshmi Rani, good afternoon. Good. See, at least one, you're all more than what we could ask for, isn't it? Because I said 1 icon. Now you see a lot of students are having at least a minimum of 2 icons next to their name. Good. Anita Simon, good afternoon. So how have your 2 weekends, 2 days? How did you celebrate? How did you do? What did you do? What were you all up to? Lijo TJ, good afternoon. Lydia Verghese, good afternoon. Very nice, very nice. Number 1, number 2, all those numbers shows the katta support that you're all giving for 𝐻𝐿𝐻 Academy, isn't it? So as a family, we're all so much happy that you're all there showing a lot of support to each one of us. Savit Biju, good afternoon. Divya Devs, good afternoon. Josna Nitin, good afternoon. Elsa Mary Joy, good afternoon. Gina Binish, Kakanad, okay. Good afternoon. So so I think Gina is from Kakanad of Ernakulam. So likewise, there are some names which always the place pops up. But apart from that, see, for example, Lydia Paul from Ernakulam. Likewise, Anija Devdattan, good afternoon. Mahi Sudar, good afternoon. Deva Singamani, good afternoon. This is Vasanti from Bahrain, regular. Thank you very much, Vasanti. Very sweet of you to let me know. So at least, because as you know that I'm getting older, so at times I need a lot of repeating the same place. So what do you call Divya is Vasanti from Bahrain. Good enough. So if you have not yet clicked to our social media platform, we have just pinned the WhatsApp channel, the Telegram pages. Please do support so that you will not miss any of the insight, as well as the grammar challenges and all those new things that we have added. Our colleagues are coming with reading, listening, speaking. Neetu Madam comes with writing. So what else could you ask for? Whatever that you have asked for, we have complied. So if you need anything, you're always welcome to let us know. We'll be happy if you could incorporate it. And no sooner, as we have always come up with surprises, there are a few more surprises coming your way. So do wait. Rajisha Kutat, good afternoon. 𝐻𝐿𝐻 Joy, good afternoon. Tia Mol, good afternoon. Shiny VS, good afternoon. Grishma Devasya, good afternoon. Monica Vegas, I'm from Kuwait National Day Liberation, 25th, 26th Feb. We had holidays for 2 days. Absolutely good enough, isn't it? So hope you enjoyed your 2 days of relaxing period in Kuwait. Mali Joseph, good afternoon. Tangasuda, good afternoon. How was my weekend? My weekend was always nice, calm, went along with family member. That's it. Dinsi Robin, good afternoon. Sanita Sabu, good afternoon. So it's very, very, very sweet of you to ask about us. But we are always very, very cautious about what you all are doing and how are you all taking the learning process. So good. So if there is anything that you want us to address, you're always welcome to type. Sharanya Tulsi, good afternoon. Again, no name. But if you have not yet clicked the like button, please do click the like button. If you have not yet clicked the follow button, please do click the follow button. If you have not yet clicked the subscribe button to our channel, please do click. That shows, one, it shows the support that you're rendering towards us. Two, you will never miss. That is the most important thing. You will never miss any new videos, new insights, new grammar challenges, everything that comes your way. And I would request personally, if you feel that my classes are beneficial to you, please do not hesitate to share the very same link in your social media platform. Why? Because the more you share, that means you all feel that my classes are beneficial. But if your shares are less, that means there is something that you want me to do more better. So I would definitely ask you, what are the things that you expect me to do a bit more better, the way that you want? Please do let me know as well. Yeah, Helena Charles, good afternoon. So what are the things that you expect me to do in order to make sure that you all share, so that you feel that my classes are beneficial? What are the things that is missing? You're always welcome. I am a person who always believe in criticism, because criticism enhances another person's capability. Okay, so if you feel that you want me to address something, you're always welcome. Don't you feel what will I think bad on? No way. You're always welcome. Okay, Monica, 100% beneficial. Thank you very much, Monica. Sweet of you. So yes, as you all said, it is beneficial and all. I'm not going to keep you waiting for too long. Okay, so whatever that we have been doing, just do incorporate it on an aspect of, we have been talking about the importance of 8 minutes barrier. We've been talking the importance of 20 out of 20. We've been talking about the importance of 400 out of 400. See, whether you like it or not, you always have to remember all those three things are interrelated. It is absolutely interrelated. Okay, now why it is interrelated? Because you have to shiny congrats, you got. It is for us. We believe Neethu's family as a family. So yes, of course, we have been honored with certain aspect of our hard work, because our prime focus is to make sure that whatever that we do is benefiting you. It's not just about doing it for the sake of doing. We want to make sure that we have come up. Susan, good afternoon. Anita Simon, congrats to you on your recent award. Thank you very much, Anita. That is for the whole Neethu's family. Monica Vegas, congratulations. Thank you. Prajisha, congrats. Thank you. Christina Bobby, congrats. Thank you. Ashwati Mol Prakash, good afternoon. So I take all your sweet gestures of thank you for each one of us in Neethu's family, because we always believe as a family we grow. You all belong to our family as well. So there is no way that we're going to take congratulations from each one of you as well, because it is because of your great results as well that we are being notified, isn't it? Or we have been noticed because of your all hard work. You're just a small factor. You are the most important factor for us. Joji Johnson, good afternoon. Just small congrats. Thank you very much. Sri Chitra, congrats. Thank you very much again. Very, very, very sweet of you. I'll pass on your congratulations to each one of my or our family members. All right. Good enough. Lini Molwagis, good afternoon. Lakshmi Rani, congrats. Thank you. Very, very sweet of you. Okay. So, yes, without wasting your valuable time, let's go and dig it into the first thing. What is today's first thing? We always will tackle a part B. The question will be popping up on the screen. As soon as the question pops up, please do not waste your valuable time. Do finish it on a before time. And once you have done, just put a thumbs up or say done. Let me see how many of you can finish it on or before time. There you have the material. Please do the material and then we will discuss. Right, time have just gone, isn't it? It just keeps on popping up. 𝐿𝐴, very nice to see you as well. 𝐿𝐴 is enjoying a lovely life in UK, but still she comes up and shows that beautiful gesture of coming in between, even though with her busy life as a nurse, I do understand you're all busy, but so sweet of her to come in, listen. Miss you all being in front of me as well. Although Sophia, good afternoon, sorry for being late, no problem. I do understand that you're all busy. Christine was the first one to say done. Jismol done. Monica Vegas done. Gina done. Sini done. Sophia done. Shiny done. Excellent. Good enough. Good enough. Anu Thomas, good afternoon. Tiamo done. Okay. Lakshmi Rani done. Good enough. Good enough. Tangasudha done. Sri Chitra done. Good. Jisha Simon done. Okay, excellent. So because now I love the response, isn't it? When you respond, we become more energetic. Why? Because it's the way that you respond is how we would also look into, isn't it? So Tintu Vibin done, Ashwati Mol done, Lydia Paul done, fair enough, fair enough. So Anu Thomas done. Now would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important. Jisha Simon, good afternoon. Not just what is your answer, where you got that answer from. That where is the most important factor, because we believe in, if at all we need to correct you, we need to know where you went from, isn't it? It's not just about, that's why we told you, when you trust us and enter into this family, it becomes our responsibility to make sure that you're all there, isn't it? In order to do that, we will definitely make you out of your comfort zone, that is for sure. But please understand, it is for your benefit, isn't it? So you have to have that kind of a perspective. Yeah. Anija is the first one to say B from the middle part. Okay, fair enough. Dincy is also seconding that, saying B. Christine Bobby, middle portion. Tangasudha, B from first para. Okay. So generally it is B which I'm getting. How about others? See, do not worry about what each student have got. If you have got whatever is your answer, do shoot. Okay, don't worry about, oh my God, they are saying that I'm getting this, they are getting that. Doesn't matter. Right? Fair enough. So I want all of you to take ownership of what you have done, what you have got. Okay, so don't worry, oh my God, and all those things. Yeah. We are here to learn. Learning is a process where you make mistake, we are here to correct you. Again, you make different mistake, we are here to correct you. But if you don't, or if you don't realize where that mistake is, then it's a problem, because you're not learning. Jilmi B, Shiny A, okay, fair enough. Thiamol B, I'm sorry, okay, Savit C from first and middle part, okay, fair enough. Cine B, Sophia Thomas B, so all the three answers are a possibility, isn't it? This is the absolute reality. When you do certain way, when you read certain way on the aspect, you get A, B, or C. These are possibilities, okay? So do not worry about on the aspect of what others might think. Let others think whatever they want. Our job is to make sure that we are here to make that difference in our life. So because you all have given me all the three options, let's see what are the answer. Okay, the material will be popping up on the screen. As soon as the material pops up, please do the thing. So before, you have to always remember, you are expected to read the question. As you read the question, understand the question and underline the keywords in the question. But this case, the question is very simple, isn't it? The clinical trial is. Now, when you have these kind of open-ended, you have to read along with the sentence, okay? The clinical trial is open to people with severe respiratory symptoms. Clinical trial is exploring, I don't know whether the lines are visible for you. Let me make it a bit more darker. Yeah? So clinical trial is open for people with severe thing. Clinical trial is exploring new ways to confirm patient has a respiratory. So clinical trial is aimed at checking the expert clinical assessment is accurate. Okay. So three different things. It is for people with severe respiratory symptoms. It is open. That means it is available, accessible for all. Or is it going to talk about exploring new ways to confirm the respiratory disease? Or is it aimed to see whether it is accurate or not? Okay, so when these kind of question and the answer options are done, after that you go and make sure that you don't skip anything. See, what are they saying? Developing diagnostic tests for respiratory disease using sound measurements and machine learning techniques. So that is, they are developing it, isn't it? So you have to have a small hint on it. Okay, now read. This study is designed to help accurate digital diagnostic tests used on a smart device for common respiratory symptoms. So see, common respiratory illness in children, adults, including asthma, cough, bronchiolitis, COPD, pneumonia. These tests can be used in resource-poor communities, emergency departments, or via telehealth applications. So they're giving a lot of things. Okay, what are these tests used? The aim is to develop. So now see, I forgot to mention, elimination method is the most appropriate methodology. Okay, now see, for me, it's open to severe. No, they're saying for common, isn't it? So you can relate it saying that, okay, that is not going to be. Maybe, may not be, I'm not saying, but let's see. Okay, the aim is to develop the test that is as accurate as an expert clinical assessment, but do not need a clinical examination or other investigation such as X-rays to be performed. Now, see, they're talking about accuracy and all those things, isn't it? Aimed at checking that expert clinical assessment are accurate. No, this is not saying that it is to check whether the expert clinical. They're saying that it is to develop as an expert. So it is not them. Okay. So this can be eliminated as well. So literally we have eliminated C. Okay. Now patient with a history of chronic respiratory condition who have symptoms of accurate respiratory are included. Where? It is not just for common people, because it is the most important thing is for common people, but it can be. So this is not going to be an answer. Let's see. So patients will be excluded if they have an inability to provide a cough either spontaneously or voluntarily, are unable to provide information, consent or assent, have severe respiratory distress including use of CPAP or BIPAP, or have had abdominal eye surgery within 3 months. So I have literally eliminated 2. Now this is where, see, the study is designed to develop accurate digital diagnostic tests. So these are new ways, exploring new ways to confirm, and a smart disease to confirm the respiratory illness. Understood how they have framed? This is called paraphrasing. Understood? So the aim is to develop tests that are as accurate. So again, exploring new ways. So these two indicate that the answer is B. Congratulations for all the people who have got B. Good enough. And people who have got A and people who have got C. Hope you understood that small misjudgment has made your answer go wrong. Clear? Any doubt? Shalini C. Okay, fair enough. KSB, just small A. Dancing, keep it up. Monica dancing, Tangasudha happy, Reshma dancing, Kavita happy, Christine Bobby happy. Good enough. So I hope that wraps up your doubts, isn't it, about A and C? So see, people who have got A and C, that just the way that you read the question along with your answer options will give you a bit more of insight. Sophia Jitin is happy. Good enough. Shiny understood. Fair enough. Absolutely good enough. Good. This is what a trainer would definitely ask for, isn't it? The students who are there, who are able to tell whatever the answers that they have got and ready to accept the mistake. That is the most pivotal thing a trainer can ask as students. And you all have been absolutely stunning. Anu Thom is happy. Fair enough. Be happy, isn't it? You should be. Why should you restrict your happiness when you get things right? Good enough. So, as all of you have done with your, part B, shall we go to the next one? What is the next one? It is part A. So, part A, I'm going to tell the name. I want you to tell me how you felt about today's material and how many minutes you took to finish 20 questions. So, gastrojejunostomy. Gastrojejunostomy. Maria Chinnabettini. Good afternoon, sir. Good afternoon. This small, easy material, 12 minutes. So first, easy material, 12 minutes. Savit is saying tricky material, 12 minutes. Sophia is saying part A. Fair enough. Reshma, yes, sir, done. Very good. Good enough. How you felt about today's material and how many minutes you took to get. Sophia is saying easy, 11 minutes. Christine is saying 12 minutes. Good enough. So 11, 12, which is absolutely stunning. Keep it up. Maria, easy material, 14 minutes. Okay, fair enough. Reshma, easy material, 13 minutes. So 11, 12, 13, 14 is there. Very good. How about others? Anybody who have done in our expected one? 8 minutes. Kavita Balaji, 10 minutes and 24 seconds. Absolutely good enough. Precise, is it? This is what is very much stunning about each of our students. They're very, 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 very dedicated. So hats off to each one of you. Good enough, even though I know that not all of you have told me. Okay, but people who have told me, they said, okay, easy, tricky. These are the two versions that I have. Okay. 10, 24 is one. 11 is there. 12 is there. 13 is there. 14 is there. So because there's no further response coming from your end, so let's go and fire. I'm going to fire the 20 answers. It's high time that you start taking your pencil with the answer with the same printout. Yeah. Start correcting your answers. Are you all ready? If so, give me a quick thumbs up. Let me see how many of you are eagerly waiting for the 20 answers. Yes? No? Nobody? Very good. Reshma is the first one who's ready. Very good. I love those eagerness, enthusiasm. Fair enough. Now, this one is ready. Good enough. Now let's go and see what the material is. Savit is ready. Okay, Christine is ready. Okay. Now when the material pops up, what we have to do, we are going to see what is the strategy. Sophia is ready. So the strategy, what are the things that you have to always remember? Monica is ready. Kavita is ready. Good enough. See, first and the foremost important thing, you have to understand part A is the one that you get as to start the reading. Okay. Monica, hope 20. I will. Okay. So 15 minutes is all what you get that you will have part A in front of you. That is the time that you will ever see your part A material. So 15 minutes, 20 questions. They will tell you to start. Okay. When they tell you, that is the time you start touching your material, pencil, everything as quickly as possible. Before that, please do not touch the material. Please do not touch the pencil. Just pray well. Keep yourself calm and composed. When they tell you start, do start. Yeah. So 15 minutes, 20 questions. Skim skimming and scanning. Why skimming and scanning? That is the only way that you can easily find the answers of part A. So scanning, detail look, skimming, quick look. So quick look, they say 1 to 2 minutes, but I say only take 15 seconds for each text. As when you're finding the differentiation, please do not forget that you should remember what are the things that you have underlined on the aspect, just an overall gauge. Okay, so you are expected to underline the keywords. Okay, so if you will have 4 texts based on one common theme. Now keywords, I'm just going to show you how quickly you have to. Okay, so gastroginginostom is a surgical procedure to create new connection between your stomach and the middle section of the small intestine for the jejunum. You might have the food bypass, duodenum, and the duodenum medical problem working. For example, if it is blocked, the lower stomach of the entry and the food bypass, and the solution is to attach one upper part of the stomach. In the late or surgery procedure, you might have duodenal obstruction, stomach cancer, duodenal cancer, peptic ulcer. So these are the general things. What is gastrojejunostomy? Where is it affecting? What is it doing? Okay, you're bypassing it. Food. This can be used to do weight loss, and there are 3 cancers that is mentioned. Likewise, you should go through each text. So put you into sleep under general anesthesia. So during procedure, what are the things that you're going to talk? Patsy is talking about complications. What are the complications they're talking about? Postnasal nausea, deep vein thrombosis, anastomotic leak, bowel obstruction. Then there is a study. Done. After this, you're going to go to the question. So there are 3 types of question in this 20. So 1 to 7 are called match the following question. 8 to 14 are called short answer question. 15 to 20 are called fill in the blanks question. You should remember these types of question numbers, and on top of that, the instructions. So 1 to 7, these are called match the following question, where the instruction said you are expected to write any of these letters, and you may use any of these letters more than once. Okay, keyword referencing is the only way that you can find the answers, and that is the most appropriate way. See, 1 to 7, even though you are only expected to differentiate which text this falls under, not to find the absolute sentence. Okay, do not waste your valuable time on this. So interval needed for the accomplishment of gas. So where are they talking about interval? During procedure, is it? So there should be P. Okay, now where you get that? Okay, just because that you're very curious on the aspect. So interval between, it usually takes between 2 and 4 hours time is what they're talking about. Now, which demographic exhibited reluctance toward the undergoing gastrectomy? So they are saying somebody who have, so this is during the study, isn't it? During study, somebody would have done against gastrectomy. Yes or no? Yes. So elderly patient who refused gastrectomy. So that is it. So question number 2 there. Understood. So D. Frequently observed adversity. So something to do with complication. Where are they talking about complication? Only one place complication, isn't it? C. Understood how you refer? So this should be as a practice that you should look at. Yeah. Now, circumstances to undergo gastrectomy. So where are they saying the reasons that you do? So go. Gastrectomy can be a part of this, or you can have to treat these. Done. Okay, so A. What can be avoided? Keeping patient in an anticoagulation post-surgery. So post-surgery. Definitely somewhere in C, isn't it? Post-surgery and all those things they're talking where? See, it's always possible complication for any operation is deep vein thrombosis. So they're saying patients should be kept under anticoagulation regimen until they are ambulating. Understood. So what can be avoided? Walking. The connection between the body mass and gastrojejunostomy. So where are they talking? It can be used for weight procedure and all. So A. It can be used as a weight reducing surgery, isn't it? That's all. So where is the hub for gastrojejunostomy procedure in 2000? So where is the study? D. Understood. So roughly you can complete this 1 to 7 in a minute of time. Okay, as with your practice. Okay. Now 8 to 14, these are called short answer question where the instructions say the answer can be a word. Can be a short phrase. Short phrase can be anything between 2 to 3 numbers or both. All right. Now, instruction differs, but the strategy is still the same. What is identified as a primary sign of anastomotic leak? So, where is anastomotic leak? Go to C, isn't it? That's the only place. Now, what is the sign? The leak is a feared which is most commonly present in the third or the fifth order. The first sign typically is tachycardia. So, TACHYCARDIA. Done. Good enough. If food passage is hindered, blocked by bleeding or scarring in stomach or duodenum, what condition might the patient have? So they are asking you about a condition. So what is the condition? Where are they talking about the condition? Go to A. Kavita is dancing, absolutely good enough. I love those students who enjoy, dance their achievement. Good enough. So they're talking about duodenum, food, bleeding, scarring, food passaging. So what is the condition? Peptic ulcer disease. That's it. A 3-word answer. From the duodenal end point, what is the minimal extent of jejunum that ought to be gauged? So minimal extent. So where are they talking about the minimum? So they're talking definitely during procedure. So they are saying measured out a loop of jejunum at least 10 centimeter from the end of duodenum. So what is the minimal thing? 10 centimeter. It can be centimeters or you can write 10 cm. Anything is okay. Understood? Because the other, there is 5. But what are they saying? Attach a loop of it to your stomach is the problem. That is where, that is the difference that happens. Yeah. So 10 centimeter is the answer. So what is a specific term used to characterize the novel? Now, I love this word novel, which is very, very prominent during your part C. Novel means new connection between stomach and jejunum. So what is the new connection that is called? So definitely it should be somewhere in A, isn't it? So what is the new connection called? So a gastro is a surgical procedure that creates new connection. What is it? Anastomosis. ANASTOMOSIS. That's it. Understood? Purely keywords, isn't it? Now, what is considered? Now, let's see 12th. Okay. So, what is deemed the most apprehensive complication of jejunostomy? So, most prominent complication. Apprehensive means fearful. Yeah. So, that's another big word. We try to infuse a lot of big words into you so that you get used to it. Okay. Now, where are they talking about? Definitely somewhere in C, isn't it? So what is the most? So anastomotic leak is the feared complication and the most commonly present on third, and this is the most important one. So what is that? Anastomotic leak. ANASTOMOTICLEAK. By utilizing either an open or a laparoscopic approach, which region becomes attainable? Something that you can, which axis, isn't it? Attainable, that means you're able to access it. Which is the area that you can access? So somewhere during procedure, is it? So during procedure, what are you going to get access to? Yes, what are you going to access? Tell me. Access your abdominal cavity using either open or laparoscopic technique. So abdominal cavity, ABDOMINALCAVITY is the answer. What antecedent procedure preceded the implementation of gastrojejunostomy in the study? So antecedent, preceded, all those things, all those keywords are mentioned where? It is definitely in the study means go where? Go to D. That's it. A very straight place where you are going to get the answer. So what are they saying? Chemotherapy prior to. So what is it? The answer is chemotherapy. Okay, CHEMOTHERAPY. Clear? Now, fill in the blanks. Yeah, 15 to 20. Very similar instructions. Word, broad phrase, word, numbers, both. Very similar. Redundancy should be looked into. The requirement of gastrojejunostomy arose 98 patients due to the presence of, so 98%. So again, something to do with, so 98 people. So what is it due to? It is due to gastric adenocarcinoma, GASTRIC-ADNOCARCINOMA. To reduce the likelihood of DVT and the potential formation of emboli, it is crucial to continue. So something should be continued until the patient is ambulatory. We know where this ambulatory is. C, isn't it? So deep vein is there, ambulatory is there, complication is there. So what is the only thing which is missing? So it is in the anticoagulation regime. ANTICOAGULATION Good enough. An alternative methodology enabling transit of food entails the linkage of dash to the uppermost section of the stomach. So something where it is from one particular place, isn't it? Uppermost part of the stomach. So where are they talking about this? Uppermost, all those things. A, is it? So sometimes they're saying where? It is saying sometimes the solution to attach your small intestine to the upper part of your stomach. So what is the thing which is attached? Small intestine. SMALLINTESTINE. Question 18. Exposing the abdominal cavity involves navigating through a challenging path with surgical precision, employing either open or, of course, again, you have got exposed to the very same terminology, open or laparoscopic technique, isn't it? So which I remember. Where did you get that from? You get that from, see, abdominal cavity is there, open is there. So laparoscopic technique. LAPAROSCOPI Absolutely good enough. Question 19. Continued nausea, vomiting post-gastrojejunostomy could signal a technical lapse and potential dash. So something which is there. So where are they talking about? Definitely during C, technical something, potential something. Where are they talking about? It is saying about, so typically resolves spontaneously. Supportive treatment and persistent nausea emissaries may indicate a technical error as a possible bowel obstruction. So bowel, BOWEL, OBSTRUCTION. The ultimate question for today. In order to dash, okay, see, after two, let's say when it is a verb and all, it should be definitely in its root form. Yeah, if it is a verb. The stomach, nasogastric, orogastric tube is placed into your stomach following anesthesia. So where are they talking about anesthesia? Definitely during procedure. Now where are they saying, okay, anesthesia is there. So nasogastric is there, orogastric is there, stomach is there to decompress it. DECOMPRESS. So I have wrapped my 20. High time that you start telling me. If you have any doubts, please do clarify. If not, do shoot me your total scores. Would be happy to see how many of you have made it to that dream score of 20 out of 20. Let's see. Christine, 19, absolutely good enough. Excellent. Keep it up. Keep it up. Good, good, good. Christine Bobby is happy. Good. Grishma Devasya 20 out of 20, absolutely good enough. The first one to say. Kavita Balaji 20, the second, very, very good. Monica, I did it. Very good. I told you the importance of saying, I will. Monica 20, excellent. Keep it up, keep it up. How about others? Disha 10 centimeter. What happened? 10 centimeter? CM is okay, or 10 centimeters. Anything is fine. Yeah? But the safe is when they have given you an abbreviation, do copy that. Saves time. Not for any other reason. If they have given in the text, yeah? Right. Any doubts? No doubts. Anisa, take the 20 out of 20. Absolutely good enough. Monica dancing. Keep on dancing. Zilmi 20. Very, very good. After a long time, I'm seeing a lot of 20. Very, very good. Keep it up. Grishma, thank you. I have to thank you, Grishma, for getting that score because it is your hard work. Fair enough. Any doubts with regards to any of those things that I told you? Kavita is also saying thank you. So as you all are saying thank you, that means you're all there on the verge. I know that you're all busy. So until and unless I see you all tomorrow, until with another different material, adios.